transformational change that took place in Bromley by Bow was when a community organisation, which had started very small, just with a handful of people, suddenly decided one day that it was going to build a health centre. In fact, it was going to build the first healthy living centre in Britain. The organisation had been operating for a number of years before that, but on a very small scale. But that was a moment of real transformation when we moved from looking at quite a small set of activities into providing healthcare for the whole community.
We developed a new liaison psychiatry model, which is very different from the old model. So the old model was based on disjointed services, where the patient in the middle of it was absolutely lost. But in the new model, we brought all the services together to provide comprehensive, age-inclusive psychiatric service based on one telephone number, one fax number for patients to be seen within 1 hour.
In June 2015, we opened a new specialist emergency care hospital. We reconfigured our emergency care services from 3 A&E departments within our general hospital sites to take the major components of those services and place them in a new purpose-built hospital, which provides emergency care for the highest level of patients and acute inpatient services. We have urgent care centres that remain on our general hospital sites, and our general hospitals are now centres of excellence for elective care.
Buurtzorg is the Dutch for neighbourhood care, and it operates through neighbourhood teams of up to 12 nurses and nurse assistants who provide care in a person-centred way, very holistically, act as not only caregivers but also supporting clients to look after themselves more effectively, to mobilise the families and other people around them, and to act as care coordinators.
From a public point of view, our population receive the highest possible quality care at their most difficult point in sometimes really difficult circumstances from a clinical perspective. People who have had a stroke or a significant cardiac event or have a life-threatening illness of any sort receive specialist care at the earliest opportunity in their journey from a consultant who's present 12 hours a day in the building. Our patients that come through on a planned journey are less disrupted by emergency cases who take priority, so less likely to be cancelled and have a better patient experience from that perspective.
The main difference in experience for the patient was really the main thing we're doing that project for. Before we started having the rapid assessment interface discharge service, where patients seen very quickly by professional people in the acute hospital, patients were experiencing more stigma, marginalized, were not fully understood by the staff. Also the staff working with them felt they were not equipped to deal with these challenges. But by putting the psychiatric service in the middle of acute hospital, upskilling the staff, listening to the patient, we brought it all together to provide a comprehensive, valued service for the patients and for the staff.
I think the most important success factor for Buurtzorg was having confidence that if you recruit and train professional caregivers and create an organisational environment which enables them and supports them to operate in a professional way, exercising their qualifications but also their vocational commitment and treating them as adults with common sense. If you create an organisational environment that supports them to do that, you don't also need to tell them what to do. They will know what to do.
The thing that makes the Bromley by Bow model so successful is the community ownership that is part and parcel of what we do every day. So as a community organisation, we grew up really being responsive to the needs and to the ambitions of our community, and in fact to encourage them to be entrepreneurial. So many of the projects at the Bromley by Bow Centre set up over the years have been social enterprises led by local people.
The most important factor for the success of the project was the staff that worked together as one team. It was very essential to carry the staff with us and make them to believe in the message and in the value of the service they provide in the way that made them proud of doing the service. The biggest challenge in transformation is not about doing what you think is right, but it's about proving that it's a good value for the patient, good value for the staff, but also good value for the money. So having data that can support your story and convince people actually have a good value project was the most important factor.
You do need to create trusting environments in which professionals can do what they are trained to do effectively. But organisationally, you also need to create an environment that supports them and which creates systems of accountability. And that's why Buurtzorg operates with a clear framework. They don't have lots of rules, they don't have lots of procedures, but they do have a clear framework which sets out what's expected of the teams in terms of the way they operate.
If people are considering making a big change, I think it's important to understand your reasons why you're making that change, and that's something that people can identify with and are engaged in. You will deal with resistance along the way, you will have challenges along the way, but actually they're all learning experiences and you should treat them that way. Don't be knocked off direction just because something hasn't gone the way that you might have expected it to. Potentially that might be the direction that you were meant to go in.
The one piece of advice I would give is don't give up. Most change, most radical change, most revolutionary change is in the face of some kind of opposition. There will be people who think this is such a bad idea or it's not the right time or find 1,000 reasons not to do something. But if you really believe in it and you're passionate about the cause, then the most important thing is you don't give up. Keep going and pull some good people around you so that you're part of a team and you're not working on your own.